Research in radiology is fundamental. We've seen since the beginning of radiology that radiology has always innovated medicine in several ways. At the beginning with the introduction of new equipments and with development and better use of new equipments. Now, and they've changed the approach that we have and all of us have to medicine, but also in improving patient care, in improve early detection of diseases, and much more can be done. In this phase that we have the instruments, for instance, artificial intelligence, the use of it in our discipline is fundamental. We are in a phase in which research is the only thing that can support us, because we are in a process of having a huge amount of workload that we have somehow to improve the quality of our patients, improve the quality of our activities, improve the quality of our reports. This is with a final aim of creating all the basis for precision medicine, therapy decision making, evaluation of assessment of treatment responses. This can be done with a great contribution of radiology. It's not only radiology, but radiology can provide a great contribution. At the same time, as radiologists have been always the real innovators in medicine, we really can contribute and have a leading role in research in several fields. So, for instance, in technology, but also in leading clinical trials in which radiology has a crucial role. So, radiology can really have a great role in many, many ways in research activities. In this sense, the European Society invests a lot in research in several ways, through grants, fellowships, scholarships that allow young students, but not only, to participate in research activities in main research center in Europe. And this is one of the main roles and tasks of the European Society of Radiology. EUCAIM, it's a huge project that was funded by the European Union that has the aim of collecting a huge amount of information that regard cancer patients. By doing so, we can support the development of AI tools, individualize some imaging biomarkers, very specific features that can help us diagnose a patient, not only making a pure diagnosis of a disease rather than another one, but going much deeper in the diagnosis, because now we are moving from a pure diagnosis as we did before. Okay, that patient has a cancer, that patient has not a cancer. We are going so much in detail that our information can be absolutely needed to, as I said before, go into precision medicine, define the therapy for the patient, and also assess the response. We are dealing with the health of patients, but also this would be a huge help in a better use of the economic resources that we have. The ESR will have a leading role and will support continuously EUCAIM, because this is fundamental not only for the project itself, but the entire radiological community. So this is something that it's related to our profession, and the development of this activity in field of cancer imaging and oncology will really allow radiologists to improve even more the results that we can provide and how we can support medical innovations. Okay. The ESR has decided that ABIR must be the entity that supports research projects in Europe, supports radiologists in all over Europe, but also allow us to integrate with other specialties. And in fact, ABIR is made as a principal stakeholder, the ESR, but as several other stakeholders that participate in this Institute of Biomedical Imaging. So it's a way of putting together the forces in radiology, but also gathering data. That has all the competencies to help researchers in getting funds and also in conducting different projects.